Hey Spartans, this is Dr. Bianca Wentzell, biology professor at St. Thomas Aquinas College. I'm here today to give you some tips and tricks about mask wearing to help you out this semester. So the first thing to answer is, what kind of mask can I wear, or what are the best masks to wear? Well, first things first, you shouldn't be wearing a mask that has a valve in it. A valve kind of provides an opening to allow for respiratory droplets and aerosols to move in and out. So that's not a good choice. Other choices you want to avoid are things like bandanas or gaiters, which tend to have very thin fabric and they don't necessarily fit well to the face. But something that you should think about wearing are the face masks that fit very well to the face and are composed of multiple layers of fabric, especially if that fabric is very tightly woven. A really good choice for a mask to wear are the masks that were provided for you by STAC. And these have multiple layers of fabric. They have adjustable ear loops to help you fit tightly to the face, and they have a nose wire, a bendable nose wire, which helps a lot as well. They also have a special pocket inside where you can add an extra filter if you'd like. You don't have to. These are already composed of multiple layers of fabric, but you can buy filters like this one. This is a PM 2.5 filter. It's many layers of different paper with a carbon filter in the middle, and you can add that for extra layers of protection if you like. But when you put these masks on, you're going to want to make sure that they fit very well to your face and cover both your nose and your mouth. So you want to adjust the ear loops and put them over your ears. This is a little loose, so I'm going to tighten them up. And you want it to go to the bridge of your nose and just under your chin. You want to make sure that it's not pulled down, because when it's pulled down, there are gaps here. You want to make sure it's up on the bridge of your nose and that you bend the nose wire so that it fits very tightly around the nose and we're still under the chin. Sometimes if the ear straps are too loose, it can slide up and down and expose the nose. So you want to make sure that they're tight enough. You don't want them to hurt your ears, but you want them to be tight enough so everything conforms well to the face. And when you're wearing your mask, you want to make sure you refrain from touching it. I know that's really hard. Sometimes it moves around or feels uncomfortable, but the whole point of a mask is so that it catches possible respiratory droplets or aerosols containing a virus, containing COVID-19. So you have to pretend that your mask has done its job and has virus in it. Touching it with your hands would transfer the virus to your hands. So make sure you refrain from touching your mask as much as possible. If you do have to touch your mask, make sure you wash your hands really well or use hand sanitizer afterward. When you're all done wearing your mask, you can take it off using the ear loops, and that way you don't have to touch the mask itself. And then you're going to want to take and put the mask directly into the wash, either into your laundry basket, into the washing machine, into a sink to hand wash it. Make sure that you wash your mask after every use if it's a washable mask. If you have a filter inside, you just take and pull the filter out. The filters can be set aside and reused after 72 hours. But the mask should go in the wash. And as soon as you've touched your mask again, remember to wash your hands. Use your hand sanitizer as well. But make sure you remember to wash your mask after every use. Do not reuse it. An exception to that could be for disposable masks, such as the surgical mask that I have here. These masks, because they can't be re-washed, you can consider reusing them. But just like with the filters, don't reuse them right away. Make sure they sit for 72 hours, and you can put them in like a paper bag or a container of some sort and set them aside, and make sure you know when you set them aside so you know when it's time to reuse it again. So some of you have been using these types of masks. The same rules apply. You want to make sure they fit well to the face. So for this one, you definitely want to make sure that you use the bendable nose strap. So when you put this around, make sure that it's going on the bridge of your nose and under your chin. Now for this one on me, it's very gappy. It's very gappy in the sides and under the chin. So what I do is I try to modify it by tying a knot in the loop. So I wrap it around my finger, I pull it through, and I make a little knot. This is essentially tightening the ear loops just like with the reusable STAC mask, but it just doesn't have that piece. But I just knot it. And then when I put it back on, let's see. It's much tighter to my face. It's no longer gapping on the sides. It's tighter to my cheeks. It's tighter underneath, and it's tight on the top. So this is one way that you can wear your disposable mask. Again, when you're all done with it, you take it off by the ear loops. You can't throw this one in the wash, but what you can do is set it aside in a safe place that you remember when you took it off. Let it sit for 72 hours. And then you can reuse it. When it starts looking dirty or like it's falling apart, then throw it away. But those are just some tips and tricks for mask wearing. And just really make sure that you're covering both your nose and your mouth when you're wearing a mask. You do breathe in and out of both of those parts of your body, so it's really important that you cover both of them. I hope this helped. Thank you guys for doing so well wearing your masks around campus, and I will see you all soon.